Oh, good morning, Dr. Ford.
Oh, hey, Sean. Good morning.
Hey, how are you?
Good, thanks.
Nice. You ready for 20 questions?
Sure am.
Nice. What time did you get up today in the morning?
4:30.
And what did you have for breakfast?
Same thing every morning. Coffee, a smoothie, and some toast.
And what's your skincare routine?
I usually start off with a moisturizer, and I put on some Retin-A cream at night.
You're driving to work and stuck in traffic. What are you listening to?
I usually make phone calls.
And in a few words, why did you decide to build this facility?
To better serve our patients with all services under one roof to be more efficient.
And what is something that worked better than expected about the facility?
How efficient we are.
What's something that you want to improve about the facility?
Bring more people on to offer more services and better care.
What was the hardest part of getting to this point?
We built our facility out during COVID, and things took a little bit longer than expected.
In a few words, what's next for this practice?
We're building out a new facility downstairs, which is another operating room. So we have one operating room, it would be a second, and also a non-surgical space.
What surgery did you just perform?
I just got out of surgery downstairs, and we did upper lower blepharoplasty with some fat grafting.
How many days a week do you operate?
Usually 3 days a week, Mondays, Thursdays, and Fridays.
And what time will you leave the office today?
I typically am done around 6 o'clock.
How do you re-energize?
I have 3 young boys at home, and they really keep me busy.
And what is your mantra that you live by?
Never give up and always do the best that you can with everything that you do.
And what are you reading right now, Dr. Ford?
I listen to audiobooks on the way to work sometimes, and so there's a great one called 0 to 1.
Thanks. And where did you do your training, Dr. Ford?
I did my residency training at Western, and then I did subspecialty training in oculoplastic surgery and facial aesthetic surgery in both Atlanta, Georgia, and Baltimore, Maryland.
How is your training different than other plastic surgeons?
I have oculoplastic training, so eyelid surgery training as a subspecialty. So it allows me to see patients with both easy eyelids and difficult eyelids and do their surgery in a very safe and predictable way.
And what do you have to say to other surgeons who are interested in lower eyelid surgery?
Try to do a lot of that surgery to be as good as you can be at doing that procedure.
And what about for patients, Dr. Ford?
See someone that does a lot of that type of surgery.
Thanks, Dr. Ford. Have a good day.
Thanks, you too.